Weekend Health Roundup. Chief Medical Officer of HERS and women's health expert Dr. Jessica Shepard joins me now. Dr. Shepard, thank you so much for being with us. Let's start with autism rates in the U.S. Many autism advocates and researchers are refuting Health Secretary Robert F. Kennedy's claims that autism is a preventable disease, while he also claims that there's a link between vaccines and autism. He also doubled down this morning in a radio interview, calling this an epidemic in our country. What are the facts here?
Yes, this is what I love is facts. And there are a lot of things that you said just there that we have to actually go back and fact check. So when we actually think of an epidemic, when we think medically what an epidemic means, that really is a rapid increase in what you would see in a disease in a short amount of time. But when we look at the statistics of autism, it has increased from maybe 1 in 44 to 1 every 36. So it doesn't really constitute an epidemic. And the reason why is there are multiple defining factors of what is a diagnosis of autism. So we've gotten better with the tools in how to diagnose autism, but that doesn't necessarily mean that there is an increase in autism itself. And when we have heard about autism over the last week, especially because there's been so much highlight on it, it is not a disease as what people would think. It's actually a neurodevelopmental disorder that has a range of what we would call spectrum in how people can present with it. And so that also complicates what that diagnosis may look like, because people may show up with different types of how they have autism. And so I think it's important, especially in this time when we are looking at people who may have that diagnosis, is not to say that it's an epidemic and then looking at the cause, which again is another reason why we're having this discussion, is because we have for a long time now, debunked the myth that vaccines cause autism.
It is so important to look at this from a factual, scientific standpoint. Dr. Shepard, you actually spoke with actress Holly Robinson Peete, who has a son with autism. You spoke to her about these claims.
Yeah, she is very vocal this week because she has a son who has autism and has been very verbose with how she wants people to understand what it means. And the fact that she has a son who's still able to work and still does all the things which earlier this week was cast a very, very dark shadow on those who are diagnosed with autism. So that is another part of this, is that there are families who are impacted by autism. And Holly is very profound in letting people know that they are a very big part of our community and society, and that autism is not a death sentence.
Yeah. And Dr. Shepard, let's turn to the measles cases, because this has been concerning. They've now been confirmed in 27 states. Federal officials are warning funding cuts are now threatening the response to mitigate this outbreak. What concerns do you have, and how could funding cuts impact the way that we respond to other outbreaks?
Yeah, so now when we're talking about a rising number of outbreaks in a short amount of time, this actually what we would look at more of an epidemic than we were talking about before with autism. So now that we have more cases, the national number is a total of maybe 800 plus, which we will now surpass what the total amount of cases were in 2019, which is around 1,250. So this is where we do need to pay attention when we think of health, using vaccines, and where they have been proven for so long that this is what actually decreases the outbreak of measles.
So interesting. And we've actually seen RFK Jr., because we were talking about him, sort of reverse course on that topic. Lastly, though, I want to ask you about new data published by the Journal of American Medical Association that shows women between the ages of 18 and 25 are now binge drinking more than men of the same age. How much alcohol constitutes binge drinking, and what's behind these numbers that we're seeing?
Yeah, binge drinking itself is having 5 or more alcoholic drinks in one setting or within 2 to 3 hours. So typically where you start to see that is more with social drinking on the weekends, when people are hanging out with friends. So there has been a study that is actually looking at how we're starting to see the reversal in young women between the ages of 18 to 25 who are doing it more than their male peers. So this is concerning, because there's two things physiologically that women actually metabolize alcohol much differently than men. And usually when we think of body volume, women typically have a lower or a smaller body volume. So this again can have some health implications. So it's something that needs to be discussed. And when we talk about alcohol in general, whether it is male or female, is to make sure that we are actually working to decrease our alcohol intake.
Any suggestions or ways for how to go about doing that?
Yeah, ways that you can do that is actually keeping what we call accountability checks. And one that you can do is have your accountability partner, similar to when we said designated driver, always having someone there who's aware of what's going on with the group and making them the accountability partner. The other thing is to stagger your alcohol. Many times, if you drink something that's non-alcoholic in between alcoholic drinks, it may decrease your desire to have another alcoholic drink. And what we're looking at is that short time frame. So if you're going to do it within 2 to 3 hours, is saying within this 2 to 3 hours, instead of having 5 or more drinks, maybe I'm going to decrease that to maybe 3 or less.
Yeah, good ideas there. Dr. Shepard, thank you so much. We appreciate you.